Welcome to the Healthy Body. Dr. Alex here. Today, we're diving into a topic that many people hesitate to discuss openly, but it's one that affects millions and is absolutely worth understanding. We're going to explore why erections sometimes fade during intimacy, and more importantly, what you can do to prevent it and regain confidence in your performance. If you've ever started out strong only to lose firmness minutes later, leaving you feeling frustrated, embarrassed, or even a bit hopeless, please know, you're not alone. And you're certainly not without options. In fact, by the end of today's video, you'll understand the 7 most common reasons erections fade during sex, along with practical, evidence-based strategies you can start using immediately. I'll also share clinical insights, natural compounds with research-backed benefits, and everyday habits that can transform not just your sexual health, but your energy and overall well-being. Before we go further, if you're passionate about improving your health, vitality, and quality of life with practical, science-backed tips, I'd love for you to subscribe. It's completely free, and it ensures you never miss a future episode that could make a real difference in how you feel and function. Now let's start by quickly reviewing how an erection actually works. Because once you understand the process, it's much easier to see where problems can occur and how to fix them. When you're sexually aroused, your brain sends signals down the spinal cord and through the pelvic nerves. These nerves release a special chemical called nitric oxide into the smooth muscle cells lining the arteries in the penis. Think of nitric oxide as the green light, telling those arteries to relax and open up, allowing blood to surge into 2 sponge-like chambers called the corpora cavernosa. As the blood flows in, tiny valves in the veins close off, trapping the blood and creating the firmness you feel. This is a beautifully orchestrated balance between nerve signals, blood vessel health, and tiny muscular changes in the penile tissue. But here's the catch. With age, the body's ability to produce nitric oxide can decline dramatically, sometimes by up to 50% between age 40 and 70. Without as much nitric oxide, the arteries don't get that clear open up message, and the whole process becomes slower and less effective. The good news? This decline is not a life sentence. You can support your nitric oxide production, improve circulation, and strengthen the nerve and vascular function needed for erections at virtually any age. The 7 most common reasons erections fade during sex. Reason 1. Gravity working against you. It might sound strange, but the position you're in can affect blood flow. If you're lying flat on your back with a partner on top, gravity can actually pull blood away from the penis, especially if you already have a condition called venous leakage, where the valves in the veins don't seal properly, allowing blood to escape. Reason 2. Psychological interference. Your brain is your most important sexual organ. Worries about performance, distractions, or intrusive thoughts can shift your body into fight or flight mode. The sympathetic nervous system, which directly counteracts the rest and digest parasympathetic state you need for erections. Reason 3. Decreased penile sensitivity with age. Over time, nerve endings can become less sensitive due to normal aging, reduced circulation, diabetes, cardiovascular disease, or past injury. Studies show sensation can drop by 30% or more between ages 40 and 70. Reason 4. Insufficient mental arousal. Even if you're physically stimulated, if your mind isn't fully engaged, your brain won't send strong enough signals to keep the process going. Stress, relationship issues, or environmental distractions can all play a role. Reason 5. Performance anxiety. If you've experienced erection loss before, the fear of it happening again can trigger the very problem you're trying to avoid. This is the classic self-fulfilling prophecy, and it's surprisingly common. Reason 6. Cardiovascular health issues. Erections are fundamentally a blood flow event. Conditions like high blood pressure, diabetes, high cholesterol, and plaque buildup in arteries can all reduce circulation to the penis, sometimes years before symptoms show up elsewhere in the body. Reason 7. Hormonal imbalances, especially low testosterone. Testosterone supports libido, erectile quality, and sensitivity. Levels naturally decline about 1% per year after age 30, and low levels can noticeably affect sexual performance. How to regain and maintain strong erections. Evidence-based solutions. Solution 1. Empty your bladder first. A full bladder can press against pelvic nerves and disrupt erection signals. It's a simple fix, but surprisingly effective. Solution 2. Choose positions that work with gravity. Standing, kneeling, or having your partner on top can help keep blood flowing toward the penis. Solution 3. Prioritize foreplay. More time spent building arousal benefits both partners and increases stimulation, making it easier to maintain firmness. Solution 4. Avoid alcohol before sex. Alcohol dulls nerve reflexes, reduces blood volume through dehydration, and can impair erections by up to 25%, even in moderate amounts. Solution 5. Space out ejaculation. Your body needs time to replenish key hormones and neurotransmitters. Many men over 40 notice better erections and stamina when they wait 7 to 10 days between orgasms. Solution 6. Consider a constriction ring. These apply gentle pressure at the base of the penis to trap blood. Safe when used correctly, they're especially useful for venous leakage. Solution 7. Support vascular health long-term. Regular exercise, a nutrient-rich diet, and targeted supplements like French maritime pine bark extract, L-arginine, and pomegranate extract can boost nitric oxide and improve circulation. Solution 8. Address sensitivity loss. Optimize testosterone levels, use controlled vibration devices to stimulate penile tissue, and focus on lifestyle choices that support nitric oxide and vascular health. And a quick note: the supplement market is crowded with products that overpromise and underdeliver. I only recommend clinically tested options with proven ingredients and proper dosages, such as L-citrulline from watermelon extract, for better blood flow; saw palmetto, for prostate support; zinc, for testosterone maintenance; ashwagandha, for stress reduction and libido boost. From my experience, the most lasting improvements come from addressing all aspects of erectile function: vascular health, hormone balance, nerve sensitivity, psychological factors, and practical mechanics. Rarely is the issue caused by just one thing. And remember, erectile health is closely linked to overall health. Improve your cardiovascular fitness, and you'll often see improvements in energy, mood, and sexual performance as well. If you're finding this information valuable, now's a great time to subscribe so you don't miss future episodes designed to help you live with more energy, vitality, and confidence, no matter your age. Most importantly, please don't suffer in silence. These issues are common, treatable, and nothing to be ashamed of. With the right approach and consistent effort, you can regain sexual confidence and enjoy a fulfilling, intimate life for many years to come. Take care of yourself, because you're worth it. If you enjoyed today's video, make sure you're subscribed to The Healthy Body for more trusted, science-backed health advice to help you look, feel, and perform at your best.